What is one of the things that scares you guys the most?
That was really scary. Like we were doing an all-on-4, and then he just, where am I? You know, he had no clue where he was at, and we're like, you're at the dentist in Mexico, and he's just looked at us, and we're like, oh. Shit.
And I keep the thing in place.
I'm not repeating the impression.
Keep throwing up. I have to get this done.
Oh my God. What happened? Everything is good? And my anesthesiology tell me, yes, everything is good. You can continue with the surgery. Maybe 10 or 15 seconds, I feel very
forgot
bad.
how white your patient.
First time I got him all out, I counted 28. So I was like, you know what? I'm going to count him again. 27.
Oh my.
Then I counted again, and 27. So she actually did swallow one.
The technology make the things more easier for us.
Yeah.
But still have to be someone who do the thing.
Yeah. Decision making. Because at the end of the day, we have to make decisions. And I don't think AI or robots are going to be able to.
Hello, welcome to Supremedental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. And today, we're going to have our dental Halloween special. So we have Dr. Luis, we have Dr. Elias, and then we have Dr. Spooky, Dr. Ivan. So we want to talk about a couple of the experiences that we've had here at the clinic that have been a little spooky, what to say, a little bit different. Obviously, we know that dental can sometimes be hard. We know that dental is not always the nicest things that you guys see, because some patients come in with lots of problems from years and years and years. But let's start by asking you guys, how many times do you think you guys have been bitten in your finger? Because that's pretty terrifying. How many times has someone bite your fingers when you guys were taking impressions back in the day? That's pretty scary to me.
Oh, yeah. I remember a time ago with my patient. I remember it's a full mouth restoration. It's in the third day. Is the follow up. I remember the inspection when I explained to my patient, please open a little bit because I'm gonna check the bite. I don't know what happened. The patient closed immediate, and with my finger inside, I remember it's a lot. I feel a lot of pain. But the patient the reaction is open in I don't know 1 or 3 seconds later.
That's something quick.
Yeah, very quick. Yeah, it's a bad experience.
He's like, yeah, it was a bad experience, and I lost. I will always miss my finger.
Yeah.
What about
Can
you guys?
see it?
Yeah. What about you guys?
Well, it does happen. It does happen, especially after you do, like Dr. Luis mentioned, a full mouth restoration preps, and they're numb, right? And they can't feel a thing, and the preparations are sharp, and you're taking impressions or you're doing whatever, and your fingers are inside their mouth, right? And they start to close because they're tired, and they start to apply a lot of pressure, and they can't feel that they're actually biting onto your finger. I've bled. Yeah, broken.
Wow,
broken
really?
gloves. Yeah, with preps.
Oh my God. Wow.
Oh, broken a nail?
No, just like they bit right into the finger. Yeah.
Just bleed.
Yeah.
Okay. Oh my God.
It happens to me always when I'm getting x-rays. I don't know why. It's like in the United States, when they're getting x-rays, they put you to bite something. I was put the thing, and I just say to my assistant, like, to press the button to get the x-ray, and they always beat me. That happens all the time.
That's
All
true.
the day.
That still
Even
happens.
today.
That still
Yeah.
happens.
Yes, very often.
Wow.
Yeah, always is the same situation.
Yes, it's like,
Because in Spanish is, hey. I don't know. I don't understand why the patient ear different.
Ear is different.
Is same to bite. the reaction is close.
Close quickly.
Yeah, it's a normal situation every day.
It's always like, tómale.
They bite you. They get a finger sandwich.
Yeah.
Well, that's pretty terrifying. What is one of the things that scares you guys the most when you guys are working on a patient? One of the experience that really scares you. So let's say, for example, I come in and I'm getting my smile done. What is one of the things that really scares you about a patient, about a situation that you're put into?
Okay.
Maybe a crazy patient.
A crazy patient.
Yeah.
Yeah, we get some of those too. We get everything. This is true.
Yeah.
I remember one experience is long time ago. When I work with implants, I need a tool. It's a small tool. It's a driver. I remember I lose my driver. When I asked to my assistant, when is the driver? My assistant tell me the patient swallowed the driver. Oh my God! No! Oh my gosh! What? Really? And my assistant, I remember Alondra tell me yes. The patient swallowed the driver, and in the same time, I remember I can see on the floor, I can see the driver. When I see the driver, oh my God, I feel very, very good. It's a really bad experience.
You know, I was about to ask, did you guys charge for that driver?
Oh my God.
That was scaring me. That was the second scary. I was like, I was thinking that when you were silent, I was like, wow, what driver was it? Was it a Straumann driver?
Is it
If it was, it's going to be a lot more expensive.
Yeah.
What about you?
I had an experience when I first started out. I was trying on 28 crowns on this older Russian lady. And you know how we first try on the crowns, they're not cemented in, so they can actually take a look at them, so they can.
But they have movement because they're not cemented in.
That's the thing, yeah. So I don't know if it was a language barrier or something between my English and her Russian, and I told her to bite and take a look at them, and she coughed, and she started coughing, right? So I was just trying to pick the crowns out of her mouth. She had a flight the next day, so I had no time, you know. The first time I got them all out, I counted 28. So I was like, you know what? I'm going to count them again. 27.
Oh, my
God. I counted again and 27. So she actually did swallow one. And, you know, and I told her, hey, you know what? I'm gonna redo the crown. I'm going to do it for tomorrow. You know, I was thinking about the flights, the lab time. And she's like, no. And she got up and she threw it up. She gave me the crown. Oh. Yeah.
Wow. That's a tough lady.
Yeah. Tough Russian lady. Yeah.
With a crazy patient. I imagine. Yeah.
The weirdos.
Yeah.
I think one of the things that really scares me, and I'm not a dentist, but it really scares me, is when we get somebody and they look at their mouth and they're quiet. Yeah. And I'm just like, they didn't like it. They didn't like it, you know. They didn't like because they're just like, and they're just like, and I'm just like, oh my gosh.
You know,
and I feel like the whole world just stopped, and I can hear like a fly, like, zzz, like, you know, everything's quiet.
Oh my God.
And then they go, right on, man, I like it. And I was just like, you know, because you don't know if they're gonna like it or if they're not gonna like it, even though there's. In different procedures, there's tests that we do that they go through. You guys go through testings, and then you guys give us a green light to keep on going. You guys don't like this. You guys like this. We can make changes. Even then, sometimes there's patients that say, "I don't like it," but all the tests have been showing that.
Right, the prototypes.
Yeah.
And we showed them the pictures and everything, and they've always said yes. And that's one thing that really scares me.
Welcome to Children's Dental Facts. Did you know that teeth grow in your gum before you were born? You heard it first at Supreme Dental Podcast. If you didn't know, well, now you know.
Also, what really scares me is the deadlines.
Yeah.
sometimes, and as a patient, one thing that you guys really, really need to take in consideration is if you guys are coming down full mouth restoration, you're getting 28 crowns, you're getting veneers, you're getting the second phase of your Zerpic, of your all on 4, all on 6, whatever it is. Always give yourself some wiggle room, because there's some patients that come in and say, okay, I'm leaving on the 4th day in the morning at 7 in the morning. That means that the border opens at 7, or at some point it opens at 6, but there's no shuttle at 6. That means they got to leave the day before. That means that there's no room for error. There's no room literally to repeat on the 3rd day if anything goes wrong or if they don't like something. And those time frames to me sometimes are very not realistic.
Right.
Like in the United States, they tell you come back for your uppers in 3-4 weeks or whatever it is. And right here is from one day to another. So then I feel that sometimes patients come in and they don't have realistically that it's not even us sometimes, you know, the electricity went out in the lab, something happened in the lab, or they, back in the day was with impressions, they bit wrong. Remember all those times that we would take impressions and then they would leave and then they would tell us 3 hours later, the impression's wrong. And the patient was in Yuma. What do? We got to call him back, but it's already 9 o'clock or 10 o'clock and the border's closed. We got to get him back tomorrow in the morning. So things like that. So always give yourself some wiggle room. This is not a car part. We're not mechanics. These guys are dentists.
Yeah.
Things can happen. An extra day will make a difference, a world of a difference. And even if everything goes perfectly, which most of the time it does because you guys are very talented, you have another day for a follow-up. Or that extra day for shopping. Or whatever you want to do. Yeah. Like, use that to your advantage. Because things can happen.
Yeah.
You know, things can happen. We control the controllables, but sometimes not everything is controllable. But that's one of the things that really scares me. That call from you guys when I see Dr. Elias. Oh my God. Something happened, man. Or Dr. Luis at 9:30 at night. I know he's not calling me because of the Sunday night football or something like that. He's not calling me because of the Thursday night football.
Problems.
It's going to be like, and it starts over, hey Frank, how you doing? You busy? And I always want to tell him, yes, I am, Luis. I'm very busy. Please let me go. But yeah, that's one of the things that really scares me. Let's talk about technology. Does it scare you that people say that, what do you guys think about these treatments that you guys see online, that I took these magical beans, these magical pills, and I no longer have to go to the dentist? Do you think there'll be something in the future that dentists will no longer be required? A robot will be able to replace you guys?
This morning I talked about this thing with Dr. Alonso. I am not sure. It's probably never. The technology can what is that?
Replace
the dentist. I am not sure. But
no, especially Alonso. He's very good looking. He can't, a robot can't replace him. But
he is very well. But now I am not sure, because the human hands,
human touch.
Yes, is the most important in this profession.
Yeah, even like with robotic surgery, our patients move. You know, they're not stationary.
Yeah.
You know, they're moving. And the robot's made for something that's stationary, for like, I don't know, maybe like surgery in the rest of your body where you're under full anesthesia. But with us, patients move. You know, they have questions. They get tired, so we have to adapt to all that. So I don't think that's going to be something that's going to be done.
I think the ones who are gonna be replaced are like the ones who are not getting new training. I mean, because the technology make the things more easier for us.
Yeah.
But still have to be someone who do the thing. And I think the doctors who are not using these technologies are the ones who could be getting more
replaced,
being displaced. Yes.
Yeah. Decision making, because at the end of the day we have to make decisions. and I don't think AI or robots are going to be able to assess a decision because they don't have experience like we do. You know, we've seen things. So
Yeah, because I've seen some robotic bartenders, but they can program them to tell them what liquor to be mixed, but they can't program them to everybody's smile, which is completely different.
right.
Yeah.
So it's hopefully it's something that doesn't happen in my lifetime, because if not, then it's gonna be welcome to Supreme Dental Podcast. We have 3 robots here with us. My name is Frank Navarro, and well, no. What about? Tell me about, as a patient back in the day when you guys had all that impression that you guys was put in and all that putty you guys would put in for 1 to 3 minutes. I don't remember.
5 minutes.
5
8.
minutes.
Yeah.
Yes.
Or
And
8.
then
yeah.
the patient had like a gag reflex.
Yeah.
How many patients have thrown up on you guys?
Oh yes.
Like exorcist type of deal
On my shoes.
on your shoes.
Yes, on my shoes.
Ooh, I don't know if I could take that.
Like.
Like, not my shoes.
Yeah, I've had people throw up on me. Yeah,
You put the trash can very quickly, but still like with the thing.
and it gets all over the place. Yeah,
And I keep the thing in place.
I'm not
I
repeating
have
the
to get this
impression.
on. Keep throwing up. I have to get this on.
So you got to throw up
No,
over
I'm
my
joking,
shoes,
I'm
sir,
joking.
but don't take the impression out of your
Thank
mouth.
you, Dr. Rayman.
No, but that's good. We're not using impressions
Customer
anymore.
service of the year, Dr. Ivan, right here.
Dr. Rayman right now.
Good thing we don't. Good thing we don't take impressions anymore, guys. We're all digital, so that's awesome. Wow, pretty crazy over there. I'm gonna
Yeah.
scooch a little bit over here. Thank you very much.
Yeah, he's not wasting material.
Yeah, he's like, well, I appreciate that.
Yeah.
I appreciate that. Well, that's good. What about you guys?
Yeah, I've had people throw up on me. Yeah, the gag reflex as well, impressions, and
So what happens? They're like, all over you guys. And
It's what Dr. Ivan
you
said.
guys don't throw back at them, or what? How does it
Because
work?
you're not really sure if it's a real gag reflex or if they just feel a little uncomfortable. And sometimes they feel a little uncomfortable and you can still leave it there, you know?
Mhm.
But sometimes it's a real gag reflex, but you want to take that impression because it's so good and it's a full mouth, and you just keep it there and you really push it to the limit, and they throw up on you.
The thing is, okay, the impression takes 5 minutes. If you take it off, he throw up, you have to do it again.
Yeah.
Another 5 minutes. It's better just do the thing.
Is that like a
get it done.
Is it like a dental baptize?
Yeah, it has to happen.
Like when you guys have been thrown up on you, that's when you know you guys are like, welcome to the dental world, or
Yeah.
how does that work?
Yeah, the old school. Like we're caught in between like old materials and new materials. I think the new dentists are not going to experience
And
this.
the other thing is when it's a very small mouth, it's a big problem. The plastic, take the mold with the regular material. In this situation, I recommend the scan because it's more comfort. It's a little more comfortable to the patient.
That's a lot, and it's a lot faster.
Yeah, probably with experience, I don't know, 20 seconds, 25 seconds,
Yeah.
30 seconds.
About 40 seconds per
Very
arch.
quick, yeah.
What about you, Luis? I know you guys have. I know you have stories of people throwing up on you.
Oh my God.
Videos.
You sure?
I seen some videos.
Oh my gosh, I remember. He's an old man, probably 1 year ago. I make a all-on-forward surgery on the top side. Probably at 30 minutes, 40 minutes later on the surgery, I remember the patient what is the name?
Gag reflex?
Gag, but with a lot of liquid and food, and oh my gosh, it's a really
He just threw up out of the sun?
yes. On my body, I remember I need go to my home for a new uniform, yeah, because it's a very big gut reflex. Yeah, it's a bad experience.
Wow.
Yeah.
That's crazy. Wow. Well, see, it's not. A lot of patients say, "Well, you're a dentist, and a lot of doctors in different fields, they do different things. But your guys' work is, well, nobody's work in medical is probably easy, but You guys get in there. I mean, a heart surgeon, the patient's completely asleep. But you guys do. The one thing that I will tell patients, please, I know it's Mexico, it's amazing. Algodones, you guys can walk around, eat tacos, buy some stuff. But we get a lot of patients that get hammered, that get drunk. They can't handle their margaritas.
Yeah.
And they come in and, oh my gosh.
Like Dr. Alonso had a patient like that.
Yeah?
Yeah.
They come in and they're just like out of it. And then I remember one time, I don't know if it was one of you guys, but we were about to do a sedation. And we told the patient, no eating and no drinking. And then one of the doctors, it was a while back, I think it was a while back, one of the doctors was walking around and he seen that patient eating a piece of bread and drinking a soda. And when that patient came in, we're like, did you eat? And they're like, nope. And we're like, so who's this? And we showed them the picture. They're, oh, no, I chewed the bread and I spit it back out. Just to have the sensation that I was eating. We're like, no.
Sure.
And then we've had patients that completely are like, we have to like help them out because they're so drunk.
Right.
So just be careful when you come down in Mexico. People can't handle their liquor. And remember, you're here for medical reasons. And these guys have to, if they could work, they work. But if they can't work, like if it's a sedation, we won't take that. But I guess they like to get bitten on. I guess they get bitten all the time and
thrown up. You
guys are warriors. That's pretty scary to me. It's gonna be a good Halloween episode of things that happen. That's I was just talking to some of our assistants that I feel like our assistants don't get as much credit as they should because they're thrown up also. They get bitten on their fingers also, just like you guys. Okay. And then they sometimes have to deal with some patients, and then they got to deal with you guys too, and so like if somebody throws up on you, like Luis, that day that someone threw up on you, you left to go get changed, right?
Yeah.
But who cleaned that up? The assistant did. So it's dental is not as easy, and obviously we appreciate what you guys do. What is one of the final things you guys want? Something scary, something that you guys have seen before. I remember once, and I don't think it was with any of you guys, when one of our patients came in and she opened her mouth and half of her tongue was a different color than the other half of their tongue. And it was because she had a tongue transplant because she had cancer. So half of her tongue was one color and the other half of her tongue was a different color. That freaked me out. I was like, what is going on? And that was scary to me. But have you guys ever seen something scary? Like in somebody's mouth that you're like, what is that? Like
a fly coming out from the mouth.
Wow. That is kind of gross too. Yeah.
I think back in dental school, pediatric dentistry was like con los niños. Uh-huh. It gets wild.
Yes,
it gets wild. I mean, because some of them cannot be sedated and they need a lot of work.
So they get tied down or what?
Yeah, pretty much. Mm-hmm. And it's like everybody's on them and they're getting up and they're fighting back. And it's you're doing something good for them, but I mean, they're kids. They don't really understand what's going on. And they get up and they throw fists and they throw everything around. And you're just like running around the whole clinic around them. And it gets...
Are you talking about Luis or are you talking about the kids?
We're talking about the kids right now. Today we're talking about the kids.
Oh, okay. I got confused right there.
But it gets pretty wild.
What about you, Luis? What have you seen that's pretty scary?
We have a lot of histories, but I remember one patient. The color of my patient is so white. Is because it's in the same moment I do the surgery, but I remember the anesthesiology tell me, doctor, you can stop please because I need to check the monitor of your patient. You're okay. and in the same time, I can see the face of my patient. I don't remember that it's a white color, but in the same time, I can see the color of my patient. Oh my God! Now in the immediate, I can turn to my anesthesiology and I ask, what happened? Everything is good? And my anesthesiology tell me, yes, everything is good. You can continue with the surgery. Maybe 10 or 15 seconds, I feel very,
You
very
forgot
bad.
how white your patient was?
Yeah. But it's the normal color. Yeah.
Oh my gosh, what did I do?
But it's the stress. It's the stress.
It's the
Yeah.
stress.
It's the stress.
Yeah, you get like really into what you're doing, right?
Yeah.
I remember we had a patient also that came in and he had all his body was full of tattoos, like all his body. And he looked like a super tough guy. And I'm just like, oh my gosh, if he doesn't like the work, I feel bad for the dentist. And he had tatted every part that you could see in his body was tattoos, but it had like marks. And when we asked him, hey man, like you got tattoos, there's a lot of tattoos. And he said, oh yeah, it was a bet. My friend told me that because he wanted to break a world record. So his friend needed to do I don't know how many tattoos in 24 hours. So he just did lines in this guy's body to break that world record. But this guy was the nicest guy. But I thought, I don't know. You know how you see those guys on TV that are all tatted up and then they're like, oh, like they got 30 to life or something, you know, or whatever it's called. But this guy was so nice. But he just did it for his friend. So that was like completely freaked me out. I was like, oh man. I thought he was going to kill half of the clinic and I wasn't going to be in the half because I was going to take off. But,
Yeah.
well, thank you so much. Thank you so much for being here, guys. This is the Halloween special. It smells like somebody turned off a candle. It's George over there. I think the scariest thing that's ever happened to George has been us because we pressure him to do a lot of videos and can't handle it sometimes. But I want to thank you guys. I appreciate you guys for listening. I appreciate for you guys liking and commenting on our videos. And anything else you guys want to say?
I once had a patient that during the IV sedation, he like just woke up and he couldn't remember where he was at, and that was really scary. Like we were doing an all-on-4, and then he just, where am I? You know, he had no clue where he was at, and we're like, you're at the dentist in Mexico, and he's just looked at us, and we're like, oh, you know, he couldn't remember where he was at, and then like after a minute, he's like, oh yeah, you're Dr. Eli, and he went back to sleep. But it was a minute that he just woke up like the Undertaker, and he's like, where am I? Yeah, he had no
With
clue.
a different voice. Where am I? Wow.
Yeah.
Well, this has been the Halloween special, guys. Remember, please, each and every one of the kids who have been watching our podcast, thank you so much. Please go out there and eat lots and lots of candy so you guys can get cavities, and we'll see you guys back here at Supreme Dental years from now. Thank you so much. Have a good one, guys.
Happy
Bye-bye.
Halloween. Thank you.
Happy Halloween.